So certainly on the healthcare side, going to your physician, if you're concerned at all, is definitely important. Walking into the office and saying, I'm concerned about my child's weight, or I'm concerned about my own weight. Can you tell me what I should need to do? Because there are a lot of physicians that are uncomfortable with the subject. Don't feel like they can bring it up, are uncomfortable using the word obese or fat in front of people. You know, parents have a certain level of guilt as well if their child comes in and they're obese, and if you tell them your child is in this overweight or obese category, they may have a certain level of guilt as well.
And so defensive or something.
Exactly. So bringing that up, if you're the person that's actually concerned, to your physician might be that one barrier that you can break if you truly are concerned, because that may give the permission to the physician to talk about it. On the other flip side, we're working as healthcare professionals on better training our physicians to have those conversations, talking about it, addressing it at well visits and physicals, so that people can recognize it early and stop it early, as opposed to waiting till they're a couple 100 pounds overweight and needing to do more intensive treatment or therapy for that. As far as agencies go, Smart Start of Mecklenburg County is working on a program through SHAPE NC. It was a Blue Cross Blue Shield grant that they received, and they're working on the 0 to 5 age group and how to improve the health and wellness of those children, starting at an early age, so that we're really focusing on prevention and not waiting until it becomes a big problem. Mecklenburg County Fruit and Vegetable Coalition is a group in the county that is based out of the health department, and they're really working on how do we improve the access and consumption of fruits and vegetables in our community. So working on things like school gardens, community gardens, educational campaigns, working with local agriculture to make local produce a little bit more accessible, and then also working with farmers markets to have markets where the produce is available to people with low income that have SNAP benefits or EBT cards.
That's all sounds wonderful, really does. Hey. So Mecklenburg County is very active.
We're working on it.
Yeah. Okay, so now I have a question for all three of you, and I think I know what the answer is before I ask the question, but I'll ask it anyway. I mean, there are all sorts of remedies for overweight, obesity, and so on, and they range from diet and exercise, which I suppose helps the most, but medications, which tend to have side effects from what I've heard, and in extreme cases or very serious cases, bariatric surgery. And I'm sort of wondering what combination or what element of all of these remedies, in your estimation, works the best, and we'll see what you say about that. And in your experience, what do your patients seem to want? You know, when I talk to a lot of my women friends, it's always like, oh, a pill that lets you eat as much as you want and you never gain weight, basically. I mean, that's the American way. You know, there must be a pill that does that. So let's start with Dr. Marlowe.
Well, one approach doesn't fit every person. I had mentioned earlier about the National Weight Control Registry, which looks at people who have succeeded long-term with losing a substantial amount of weight, and that's spearheaded at Brown. What Dr. Wink found out was that people have all succeeded in different ways. And so some patients followed a low-fat diet, and some followed a low-carb diet. Some of them counted points. Some of them had surgery. Some of them used diet pills. The majority of them needed a weight loss program to succeed. When someone chooses their weight loss program, I would ask them to be sure to look for a program that tailors itself to their own needs, both medical and individual needs. So for my patients, what we do is we figure out what each person needs as an individual in order to give them the best plan, combining healthy eating with the physical exercise and medication if they wish. As a result, I'm proud to say that we have the second highest success rate of the medical weight loss, which is 88.7%.
Oh my gosh, that's great. Dr. Bollinger.
Yeah, I think that first of all, the key that I think we would all say is that prevention is ultimately what we're all about. I mean, I think our job should be to get each other out of business. That's where we are. I mean, ultimately,
that's very generous of you.
You know, ultimately, that's you know, it's about educating about the disease, raising awareness for what the disease can cause, And I think that's an important statement, is that we really look at obesity as a chronic disease. It's not something you can cure. It's something we can put in remission. It's something that a patient's going to have to live with for their entire life. And it's also not as simple as a magic pill or a magic plan or a magic herb. It is a multifactorial disease caused by genetics, environment, social, psychology. It's all these things, multifactorial, wrapped up into one. So we have to attack it from all sides. I think the foundation of everything that we do is lifestyle management. It gets back to nutrition, eating healthy, exercise and activity, not just working out at the gym, but parking farther, just being more active during the day. And then lastly, modifying the behavior, changing the bad habits into good habits, modifying that. So that's the foundation for how we treat the chronic disease. Then there are tools we can put on top of it. Dr. Marlowe is a specialty in medical management. There are certainly certain medications that can help control appetite or improve your glucose metabolism, things that we can do for medically. And that typically is for patients that, it can be for any patient, but certainly the majority would be for those more in the obese category, the class 2, maybe early class 3 that we discussed earlier. And then my particular specialty, being bariatric surgery, is primarily reserved for those patients, as you suggested, that have more severe weight issues. That body mass index is over 40. They have high blood pressure. They have sleep apnea. They have some significant issues where they've tried lifestyle management. They've tried maybe medical management, and ultimately they need a tool, a very aggressive tool. We like to call it giving them mechanical willpower, where we actually are able to change their anatomy to allow them either to control their portion or control their hunger, or in some cases actually allow them to not absorb as many calories, so that we're very aggressive, safely aggressive. But these are for those folks who have really have the risk or are going to have the risk that need more aggressive treatment.
Well, typically, how much would such a person weigh? Or
in general, they're roughly 100 pounds overweight. Again, we kind of take the height and the weight, but the average person we would operate on, the average man is probably about 300 pounds. The average woman is probably about 230, 240. We've operated on folks that weigh as much as 600-700 pounds.
Oh my gosh!
And certainly that's an extreme situation. But data shows that a patient that has that type of severe obesity or has severe obesity really has about a 20% chance of not being with us in 10 years. I mean, for things like heart attacks, things like strokes, all the things, the ravages that diabetes can bring. It is a severe, life-threatening chronic disease, which is why we feel like it has to be treated as a primary disease for all our primary care physicians.
Right. Dr. Mitter, do you want to add something?
Yeah, certainly I'd echo the word that you said first, which is prevention, prevention, prevention. We really need to work hard on teaching people at a young age how to move their bodies and eat well, and understanding that exercise as a child is just going outside and playing. Getting outdoors, using that energy that you already have, and not putting it into TV, and letting them be creative with it. And then also teaching people how to feed their children nutritious foods, going back to breastfeeding, going to eating proper portions, not going out to eat, not drinking the soda, not putting soda in bottles for their little babies, and working on teaching those to the medical providers as well, so that we're comfortable having those conversations from a very young age.
What I just thought of was the role of the food industry or the restaurant industry and all of this queuing to have huge portions and so on. I mean, there have been some efforts like to list the calories and so on, but what I've read is that people, when they see that they still get what they want or what's available, that it doesn't basically scare them or shame them into not having the 8 pancakes or whatever. And parental role, and it's very, very complex to me. That gets back just to a little minute on the childhood. You had already mentioned the childhood obesity problem, and any of you, please feel free to comment on you know, children. I mean, with this, all these kids getting diabetes, but type 2, which used to be never with kids, or, you know, very, very rare. What's that all about?
We're certainly seeing it more and more often. Kids are becoming more obese. We have young ones that are hitting a couple 100 pounds weight, and they're getting diabetes, and we're seeing it, and we're not really sure how to manage it quite yet because we haven't broached that subject these days. But, you know, kids are an interesting population. They don't know how to make informed decisions for themselves. If you put them in front of a plate of broccoli or a chocolate cake, they're going to pick the chocolate cake. They don't know that, you know, someday down the line I might get diabetes or heart disease, or I might not be able to work because I'm on disability. They don't think like that. They just know, I like chocolate cake and I'm going to eat it. And so it's really the responsibility of everyone around them to make sure that they're doing the proper things. And that comes to everyone. That's parents, that's schools, that's the food industry as well. You know, if they're inundated by their favorite fictional character on television telling them that they have to have this sugary cereal or have to drink that soda, they're going to beg for it, they're going to scream for it, they're going to cause chaotic ruckus in the grocery store.
Tony the Tiger was for Frosted Flakes, was, you know, my buddy. You know
Exactly.
Time is kind of running out, and I was hoping we could have some take-home messages from each of you. And I think I'll just go right down the line here. So, Dr. Bollinger?
Well, you know, I think the key message I'd like to give today is that we have to do something. Obesity is an epidemic. It's a chronic disease. It is taking years off our lives. It is taking years off our children's lives. So it's something we have to address seriously. It all starts with prevention on a local level, in the home, on a community level, in our schools, on a national level with our restaurateurs, our farmers, the farm-to-table movement. There's so many things that we can do to be helpful. So prevention, but then when it comes to treatment, I think Thomas says it very well. We need to individualize the therapy to the patient. We need to take, each person has a different lifestyle, different perspective, and then use everything we have in our arsenal. And and the hope is, and what we have a lot of hope, because there are so many. The FDA has 3 new anti-obesity drugs in front of them now. We have new technologies like microlaparoscopy, robotic surgery, single incision, a lot of exciting things, even incisionless surgery. That we have those tools that are going to be able to treat the disease, so that ultimately we're going to be able to educate and raise awareness enough so we can prevent it from happening to start with.
Dr. Mader, very quickly.
So my take home is that this is everyone's problem, even if you're at a healthy weight or if you're overweight or obese. And my messages to families would be, have family meals together, learn how to prepare good, healthy foods that are actually tasty, because they can be tasty. Go outside and play with your kids. And as a community, really think about how your role as a community member, as a citizen, could potentially be used as an impact to childhood obesity and adult obesity.
And Dr. Marlowe?
Well, I think Dr. Mehta and Dr. Bollinger did a great job of summarizing the major points, so I don't have much to add to that. I will make one comment, though, which I wanted to give compliments, and I'm very proud of one of the initiatives that we're doing. Deb Kaslick, she is the director for Charlotte Mecklenburg School System for children PE and art. And Dr. Mehta and I and many other physicians, along with Deb Kaslick, are working to bring physical education back to the school system as a requirement. And it's our game plan to spearhead that as part of the Democratic National Convention, so that we can have that as something that will then first Charlotte representing it to the rest of the nation, and then for the rest of the nation to take on from there.
Oh, great. And that will really make Charlotte a world-class city, finally. Okay, well, thank you, all 3 of you. It was really wonderful having this conversation.